Well, let's just get started here. And I will go ahead and introduce myself. I am Elise Wagner. I am the co-founder and the Chief Wellness Officer for the Functional Medicine Coaching Academy. I am just thrilled and excited and grateful to be here with you all today. And I am here with Debbie. And Debbie Vanderweyden is also an alumni of FMCA, and she's on our admissions team, and she is coming to us from Michigan. And then we've got Carrie Schultz. Carrie is an alumni as well, and she is coming to us from Virginia. So what I'm going to have them do is just quickly introduce themselves and just share a little bit about them, what brought them to FMCA. You're going to be hearing a little bit more as we go throughout the chat. And I just, again, want to encourage you all to use this chat or this Q&A feature. You can submit a question if you'd like. And so, Debbie, would you like to share a little bit about yourself?
Sure, happy to. Thanks to everyone who's joining us. It's fun to hang out with you today. So I'm with the admissions team, and an alum, of course, and also run and operate a small health coach company on my own with my daughter. So here, my path here, I guess that's what I want to get to. My path here is interesting in that it really stems from the journey of my daughter's 8-year journey with conventional medicine and just things that weren't right for her. And in the end, their tools weren't working. And so they all got fired. And then mom just had to go to work to figure it out. And I didn't know anything about functional medicine then. So in my enough is enough mindset, I just started digging. And that's what we're going to talk about today is how did I find my way to FMCA out of all the opportunities that I had. That was 2015, so the search is a little bit different, but hopefully in today's conversation, we'll be able to organize some of those things for you and help you out today. So thanks. It's fun to be here today.
Thanks, Debbie. Carrie, how about you?
Hi, I'm Carrie, and I'm from Richmond, Virginia. So I am a functional medicine certified health coach. I'm a nationally board certified health and wellness coach, and I'm also a yoga instructor. I too came to functional medicine for my own personal health journey, like so many people that we talk to that call into FMCA. It's so neat to have so many people call in with a similar story. I have my own personal health journey, but in the same respect, each one is so unique. And so I too have walked down that path, and that's what brought me to functional medicine.
Thank you. Thank you, Carrie. And like I said, you're going to be hearing a little bit more about their stories and what brought them to FMCA, what their journey was like really in finding a coaching program and really a career path that was going to support them. And so whatever has brought you here today, and if you would like to share that, please put that in the Q&A or the chat. We are really, truly here to support and serve you on your journey. And a lot of the questions that we're going to answer today, you might have the same questions. So if there is a question maybe that we haven't answered or just something that's bubbling up for you, feel free to put that in the Q&A portion and we will get that answered for you. So we're going to just dig right on in and talk a little bit about, what were you looking for? And I know we get this question a lot, which is, I get a lot of students or prospective students, I would say, who are saying, I'm looking for really something that, is very specific to what I want to learn. And here at FMCA, we talk about we really educate about a lot of different modalities and weave them into our functional medicine program. But I know Carrie and Debbie have a couple things to say on this because what brought them to FMCA and what they wanted to learn were pretty unique and different. So Carrie, would you like to start us off here?
Sure. Like I mentioned, going in my own health journey, I realized firsthand on when I changed my diet all of the improvements that came along with that in my life, just unexpected things that I didn't even realize were an issue. So first and foremost, I wanted to know more about functional medicine. That was important to me. I started down that, call it rabbit hole, and I wanted to continue exploring and digging and learning more. I also knew I wanted to help people. And I enjoy that very much. That kind of feeds me, is to be able to help others on their health journey. But sometimes, like, you don't know what you're looking for. Like, you don't know what you don't know. I wasn't so familiar with exactly what coaching was. But having those pieces to begin with, knowing I wanted to help people, knowing I wanted more about functional medicine, in the end, all of the pieces came together. Even though I didn't know exactly what health coaching was about, it all came together in the end.
Yeah, I love that, Carrie. That's wonderful. And I would say a lot of people who come to FMCA, they come because of the functional medicine. That's really what draws them in. And then they start to learn this deeper side of the coaching piece and the positive psychology piece as well. So thank you so much for sharing that. Debbie, how about you?
So what I wanted to learn, my want really started again from my why. And part of that journey I was sharing with my daughter is that we did discover in 2016 functional medicine. It was brand new. I didn't even really know what it was, like Carrie, but we invested for my daughter to participate in that. We worked with integrative doctors, providers, as well as functional medicine. Okay, so they uncovered really good stuff. But here's where my why really comes in. They weren't really listening yet to the full story. And I know that's the premise, and I'm not trying to shake anybody off. But what it came down to is that the providers weren't prepared for the time that it really takes to unfold all things. And for my daughter, that really harmed her. And I thought, as a mom, that's unacceptable. We can do better. So my why and what I was looking for in a program, because I knew it was functional medicine and I knew it was health coaching. That was going to be my vehicle. So I did choose that, and I had that highlighted. But I wanted to learn how to listen, really listen. And then I learned about motivational interviewing. That's the vehicle for that. And in order to do the work that I want to do to get the message out about the gut and brain connection and how that can really support lessening inflammation in the body and, the mood and stress disorders, because that was my thing. That was my passion. I knew I needed to learn really well. And so that's what I looked for. What I wanted to learn was all of the parts of the body, how does it work together, including that gut and brain. And then I was looking for the training, the tools onto how to coach, how to impart that education so that I can guide, so that I can support. And together we can really clean up some of those lifestyle factors, raise the awareness. I think that was the other piece I was looking for. So I really kind of got pretty clear about my why. And it was tough to, I didn't want a middle of the road. Is that the term for training? I didn't want a general training. I knew I wanted some really credible stuff. And that's how I started my search.
Thank you, Debbie. Yeah, I really can appreciate that. I would say more often than not, 99% of our student body and prospective students come to FMCA because they've had a personal experience with functional medicine and they truly want to get to the root cause, but also look at the whole picture. And then once they learn the different tools and techniques, they want to go on to serve and support other people with that. So just to kind of wrap this area up, no matter what you're coming to want to learn a little bit more about or dig a little bit deeper, our curriculum really focuses on 6 main branches. We are focusing on functional medicine foundations as well as functional nutrition. We go really deep and talk about all the different food plans. And this is all the functional medicine content that we're training on is in collaboration with the Institute for Functional Medicine. This entire program was really created with IFM faculty. And so you are going to be learning from IFM faculty they're the ones who are going to be teaching you functional medicine foundations and functional nutrition. And then we're also really, I would say, pairing that nicely with the mind-body tools and techniques and the art and the science of coaching. Like Debbie was sharing, she really wanted to learn how to listen. And we teach you how to masterfully listen. And that looks very, very different than what you may have ever been taught anywhere before. I don't think traditional schools really teach that. So, and then we're also teaching the psychology of eating, as well as there's a whole career navigator piece that we integrate into our curriculum that really helps you to build and really curate and create your own coaching career, because we truly believe, we take a functional medicine philosophy and approach. Everyone who's coming to this program is coming from a different background, whether you're a doctor or whether you're not from the healthcare field. Maybe you're coming from a marketing or engineering field or something like that. And it really, you all have different skill sets and tools already in your toolbox. And then you get to come to FMCA, and what you want to do afterwards can look very, very different for each individual. And so we'll probably get into that a little bit deeper just as we continue on here. But thank you so much, Debbie and Carrie, for sharing. And the next question that we get often from prospective students is they'll say, I'm really looking for a credible program. And so if you have ever had a chance to speak with myself or Debbie or Carrie or anyone on our admissions team, we love to answer this question. And we like to talk a little bit about what is credibility? What does credibility really mean to you? And why does it matter? And so, Debbie, would you like to kick us off here and talk a little bit about how you address this question when a prospective student asks this?
Right. Good. Again, even when I take myself back to when I was looking at the different courses, how did I decide? It's a tough thing to find that right fit, because there's, we have differences in the philosophy, our tone, just that focus of the program. But I again tapped into what's important to me. And so a credible program really was important, because I was going out to be a little bit of a traction to the mood and stress disorder world. And I was coming in with a different message. So in order to be taken serious, I was going to have something underneath me. I was going to have a good training. And so I looked for that. And FMCA did come up for me, because I'm comparing again. I really wanted something with that was approved by the National Board of Health and Wellness, because they are now the standard. And it's easy to see that in 2018, maybe that was still a little bit new, but all you have to do is pop into your LinkedIn board or, your favorite job board to see that the National Board is being required in some of the health coach positions. So this definitely was something that was on in my site. So I chose that. And then I tested it. Let me jump ahead a little bit. So when I graduated, I started my first website there, and I wasn't sure whether there's still, health coaches coming from a lot of different backgrounds. So I wasn't sure whether or not to say, hey, I'm a functional medicine certified health coach. Here's what that means. And this is why you should, hire me. But I tested it. I put it in the marketing. And sure enough, people responded to that. And I asked, of course, why me out of the choices you had. And they said, everyone else I've worked with just couldn't get it. I'm hoping you have another view. What can you offer? And there are many stories I can share that this training did support the client in front of me, and pretty amazing. So that credibility for me was faculty, experts who know what they're talking about. And then, of course, that is proven by being approved by the National Board of Health and Wellness. We know we're hitting that high level of standard training. So.
Thank you, Debbie. Really appreciate your honesty there. And Carrie, how about you?
Yeah, I just remember searching through programs. And again, I wasn't exactly sure what a health coach was when I was searching through programs. And like I mentioned before, you don't know what you don't know. And I was searching the internet for different programs, came across a lot of confusing language. People using, or programs using the word functional, or, different buzzwords, but what were they really teaching? And it was really hard to dig through the weeds and figure that out. And when you come to Functional Medicine Coaching Academy, realizing, hey, like I am learning from the faculty of IFM. I'm learning from, the best of the best, and there's no middleman. There's nothing in between me and them. So at that point, it was clear to me that's where I wanted to learn.
Thank you, Carrie. And it can be a little bit difficult sometimes, especially if you are new to this field, and there's a lot of terminology that is new to us, right? And so I really encourage everyone, as you're looking into different programs, and if you're curious, or if you are coming across, confused with some of the terminology or the words that are being used, that you're not alone in that space. And we certainly encourage you all. There's so many acronyms as well that are out there. There's the NBHWC, there's IFM, FMCA, and it's like, okay, so we are here to demystify that for you as well, and support you on your way, and really to help you give you an idea of the landscape of what the coaching field looks like, so you truly can find a program that's going to suit you and serve you. And just a couple of things to kind of tie this question up. As Sandra and myself were starting this program, and it really has come from a passion and from our own personal journeys as well into functional medicine. We really wanted to create a program that, yes, hands down was credible, but we wanted to make sure that our program, the result of our program, created competent, confident, and compassionate coaches. And that still to this day is number one, high on our list. We want to make sure that our program is the training ground, so that you can really go out into the field and be this great coach. And so a couple other things just to highlight and underscore that really, I believe, create our program to be a very credible program. I think first and foremost, and a lot of you have some questions in here about what makes us different. So this might answer a couple different of your questions, but it's our collaboration with the Institute for Functional Medicine. So if you're not familiar with IFM or the Institute for Functional Medicine, they are the program that trains pretty much all of the medical providers and practitioners. And so that is our collaboration partner. And what that means is that when you go through our program, you are going to be learning all of the functional medicine content, the foundational content, as well as the functional nutrition, the food plans. All of that is taught by IFM faculty. So the same faculty that's training the medical providers and practitioners, you are getting to learn from as well. And you're also learning from their similar slide decks. So, and you're learning from their toolkit, as well as the food plans. So you are learning from the same operating system, same philosophy. And really why that matters is when you come out of the program and you graduate, you're able to essentially, if you will, speak the same language as a functional medicine provider. So if you do end up working, let's say, in a collaborative care team, essentially a doctor or provider could give you, let's say they were a functional medicine provider, they could give you, let's say, a 2-minute or sometimes less directive about a particular patient or client. You could turn to that client, and then you understand, of course, all those directives, and you can start to implement, which is really the magic or secret sauce of the coach. So that's one piece of it, is our IFM collaboration. And the next is our, we've been a founding school with the National Board for Health and Wellness Coaching since it's their inception. And we've always held our curriculum to the highest standard, and have gone above and beyond to make sure that our faculty, that our course facilitators, that everything that we are teaching and training on meets their standard, their scope of practice, what they deem credible. And we really always try to go, like I said, above and beyond. So once you get out of our program and graduate from our program, you would be eligible to sit for the national board exam. And I would like to say that we have a 93% pass rate, which is above the industry average. And then also just a couple other things is that coming out of the program, a lot of people ask, well, what's my title going to be? And your title is a Functional Medicine Certified Health Coach, or FMCHC. And as you're maybe perusing on LinkedIn or on Instagram, you might see these initials or acronyms after people's names. And so this is a globally recognized certification. And when you come out of the program, you come out with a certificate of completion. And again, that enables you to sit for the national board exam if you would like. And this is a board exam that we have national, domestic US students sitting for, as well as international students. So, all right. I think that's all I wanted to say about that one, but I will go ahead and move on to the next one. So a lot of prospective students will say to us, Elise or Carrie or Debbie, I was really looking for a program, someone that is really going to work with me. I know that we had a question come in about, taking an online program and feeling isolated. So maybe Carrie, would you like to share a little bit about
Sure.
that?
Well, first, when I was still looking for a program, I booked a call with the admissions team. And so that person was there to work with me. Again, not just to say, this is why I should enroll in FMCA, but to say, hey, what's your vision? What do you want to do? And then here's what we offer. And do those things match up, and do they pair up? So that was really key in working with me on deciding to join FMCA. But then once you're in the program, you're part of a team. You're part of a small group of a live training session, and you're never alone. Although this is a fully virtual program, we have these small groups, and cap them at 15 people. You really get to know these people. They're your go-to people. At any point, you can, call up your teammates and work with them on whatever your questions are. And beyond that, the faculty, your course facilitators, Sandy and Elise, are so accessible during the program that you really feel like you're part of a family.
Carrie. Debbie, how about you?
First thing I'd like to say is just my hat is off to everyone who carves out time of their schedule to make that call with ATM, because I am more of that do-it-yourself person. And there are several of us who just kind of push the button and it's like, where'd that person come from? And then they're, enrolled for our next program. I think it's pretty cool. Well, that was me. So I just did a lot of my research on my own. And as I said, I've really laid things out. Today, it's easier for the prospect because we have our program checklist as a resource that we should share probably today with everyone. But then once I got into the program too, once I identified this is what I wanted to learn, how I wanted to learn it, it is the live training session that really, really is so powerful and transformational. And I think it's one of our authors, Rolnick. I think he said it best. Now, he was talking about motivational interviewing, but he said the difference between someone who learns motivational interviewing, our certificate, and mastering it and becoming it is like 10 years. And that, I think that is really true. So now that I'm in it, so what I want to say is the live training session, the people that we meet in there who become lifelong friends, the access to our course facilitator, when something's coming up and bubbling up, access to you and Sandy and the office hours. I mean, it's amazing connection, and the discussion board. When I talk with people coming in, I always say, don't forget to connect and collaborate with people on that discussion board. Take those friendships offline, start networking, in the program, not post the program. So you're not alone. That's a big, what do I want to say? Not bonus, but just a really beautiful part of this year of transformation. You're not alone.
Yeah, thank you, both of you, for sharing that. And that's something that I just want to underscore again. When we created this program, it was also about creating a community of like-minded individuals from all around the globe. And that was really, the vision is to expand, functional medicine and coaching, and make sure that everyone has access to a functional medicine health coach. And, when I think about from the beginning to, I don't like to think about the end always, but there's kind of like a life cycle, right? If you start your journey and you're looking at programs all the way through the program, and then into the graduate or our alumni program, there's truly people walking by your side. And I would like to say, this is something I'm personally really proud of, is that we truly take the coach approach and really walk the walk. And so just like we're here with the admissions team, and just like a coach truly partners with their clients, our admissions team members, we really partner with you, at least at the beginning of the journey, as you're looking and you're exploring different programs and trying to just decipher, what does this look like? And then as you join our program, you've got your course facilitator, you have your small cohort group that really becomes, this lovely lifeline that you have throughout the program. And I think about Carrie. Carrie, has been a graduate since 2019. She met her cohort in 2018, and she actually just connected with someone. It's been 4 years. They were able to connect live with someone just a couple weeks ago in person. This person was all the way from Seattle, and they had never met before. And so these connections are real. I would like to say, people are meeting, sometimes they've never met, but they're starting businesses together, or they're collaborating on maybe a book together or something. So you truly have a life community when you come to FMCA. And there is, I think, literally probably a graduate and or a student in every single state right now, and over 60 countries. So no matter where you are, there is definitely someone that can support you. And then, of course, with our alumni program, that's after you graduate, there are just so many different opportunities to stay connected with our alums and with your different cohorts, and then even beyond that as well. So lots of different ways that you can find support in and throughout the program. And then I would just like to say one more thing, is that Sandra and myself try to be as accessible as possible. We really want to make sure that you're having a positive experience through this program. Sandy and myself have office hours throughout the entire year of the program, and then into the alumni program as well. And you can come in and listen and hang out, or ask questions and network or support. And it's just a wonderful way, again, to stay connected and to not feel so isolated. So thank you both, Debbie and Carrie, for your answers there. So we're going to move on to the next question. I know you've got some questions in the chat, and I appreciate that. And we will get to those really, really soon. So one of the next statements or questions that we hear a lot is, I'm looking for a program, or, that's really going to provide resources and is really going to help me research with confidence, or maybe I'm looking for someone who's really going to partner with me. And so, Carrie, what would you share about this?
Yeah, this is the fun part, is we have, as a team, so many resources to help you research programs and compare programs on an apples to apples level. We take pride in the fact that we're here to help you realize your journey, and that everyone's journey isn't the same, and that's okay. And that's perfectly beautiful that it's not. But we're here to help you along that path. Just the other day, I had a call with somebody that is an Ayurvedic practitioner, and she's really interested in doing our program, but just wanted to kind of see how that would work for her in her line of work. And so I was able to match her up with a graduate of our program who's also an Ayurvedic practitioner. And that's the great thing about this network at FMCA, it is a family, and that once you graduate, you're still part of that family. And, it's so nice to be able to call on those alumni and say, hey, you mind sharing your expertise with this person? And, we're able to do that and provide that level of connection, clarity, allow that person to visualize, well, what can this look like for me?
Yeah, that's, I think, a beautiful resource that we have. We have so many prospective students who we have conversations with, and they want to just have another perspective, especially when they speak with me. Of course, I think I'll be the first one to admit I'm a little bit biased. And I always use that as a resource. I just have to shout out and give big thanks and gratitude, first of all, to our admissions team for creating this resource. Because I don't know if it was always available when you guys were looking for a program. But that's one of the things that, again, where we're walking our walk, we really are listening. And, when our prospective students or our current students are saying like, hey, this would be, something really helpful, or this would help me to make the decision, we're going to listen to that. And so, one of the beautiful things that we have is our alumni who volunteer and are willing to hop on a phone call, hop on a Zoom call and chat with our prospective students and just help them to answer some of their questions or give them a little bit of an insight into their world. So it's a wonderful, wonderful resource. And thanks to our alums who volunteer their time. Really appreciate that. Debbie, how about you?
The job is definitely easier today especially with FMCA's resources. And again, we're working with anyone who phones us side by side, just like a coach would really, to support the decision-making process. But if I take myself back and just try to, because again, I was that do-it-yourselfer, I was not smart enough to make that phone call over to talk to admissions, but I did pay attention, and I remember doing this. I really tried to pay attention to marketing speak and try to separate that out so I could really see the meat of the program. And that's what really supported me in figuring out what was apples to apples in the coaching program I was looking for, because there's a lot of oranges to apples out there. There are good coaching programs, of course, but I knew what I wanted, and that was functional medicine and a very strong behavior change specialist tool belt. And once I started, whittling down, then it became, I heightened my ear for who was I going to learn from, who is this program approved by, and then I went and compared and said, where are those graduates working out in the field? And that's how everything pointed back to FMCA for me. But you're right, Carrie, today there's so much that we can do. The alumni connection is powerful because you really get to hear from that perspective. And that's a private conversation. Some people that's such a great confident marker in looking at the picture through another lens. And then they can feel very confident when they make their investment. So lots of tools, and happy to talk to anybody, of course, and share all those tools when we jump on a call.
Yeah, absolutely. And I encourage those of you who are listening or watching in, if there are particular or specific questions that you have, please do reach out to us, and we'll let you know how to do that very soon. I think Debbie had put something in the chat as well. So if you're checking that out, you can also pop in the chat. And then I would just like to add a couple other things. I was speaking with a prospective student yesterday who was talking about, as he was on his pathway towards researching a program, one of his big questions that he had was, the resources. What are the resources that I have available to me when I do start a program? And his was more along the lines of the support, the tech support. And so we use Canvas. That's our learning management system. We've got 24/7 support with that. And then of course you get the support of your live training sessions, your cohort, your course facilitator. And then just underscoring what Debbie and Carrie are sharing about our alums. They are just an amazing resource to just share their background and where they're at. And then Debbie and Carrie and some of our other admissions team members, we're here to ask you some of these questions to really, we're not here to tell you, you have to come to FMCA or do this or do that, but really helping you to find the program that's going to answer your questions and help you to make a decision with that confidence and with that ease. So thank you, Carrie and Debbie. And I want to go on and take another question that we get from prospective students, which is, they're looking for support beyond graduation. As they're looking at different programs and they're wondering, what kind of support can I really expect after graduation? And so, Debbie, would you like to share a little bit about this?
Happy to. Unless you're someone who's very practiced and you're coming with a background, it's a bit scary to be newly certified as a health coach. And, again, I had a vision for what I wanted to do, but to get out into the world and do it, it's a little bit scary. So confidence for me was community, and the alumni program is amazing. And so I did join the alumni program. There's a Facebook group there. And what's cool about that is it's our past alumni. So there's a lot of practiced health coaches in there and a lot of different professional views. My surprise was one evening. This is a story I'll share because it just, this one event made the alumni priceless to me. It was the name of our company is Jenna and Her Mom Coaching and Training. And I mean, if we just think about it for a second, when someone's hurting, because we work with people with social anxiety, when someone's hurting, who do they want? They want mom. So 11 o'clock on a Thursday evening, I'm getting a young man I know now he was from Germany. He was not a client of mine, but he was coming into the Instagram page and he had suicidal comments. And of course, my heart's like, oh my gosh, I want to support. And I know my scope of practice for health coaching, and he wasn't a client. So I wasn't like really responsible, but at the same time, you want to help, right? So in the moment, you get a little flustered. So what do? I go to my community, the Facebook group, and sure enough, I got responses. Sandy was there. She commented and everybody gave me their feedback. And so I went back, I supported the young man on Instagram. And from that point, I mean, it was really a great outcome because we were able to, my daughter and I were able to talk with him, support him, get him to the right resources. And again, I don't think that would have happened as flawlessly, as confidently, unless I had that support. So for me, community is amazing, and it just builds from there. There are just so many things we can do in community collaborations, networking, affiliates. There's so much cool passion projects. There's just so much fun we can do and so much incredible work we can do when we're in community.
Thank you for that and that wonderful example. Yeah, I really appreciate that. Carrie, how about you?
Yeah, so support beyond graduation. I mean, the first thing that comes to my mind is, my live training session cohort. And like I said, we started in 2018, graduated in 2019, and we still get together about every other month on Zoom and connect. And it's kind of like our little network of coaches. We share successes, we share struggles, we're there to support one another. And it's so much fun. It's just like this family that never ends. And, we're literally from Vancouver to South Africa and everywhere in between, but we've managed to get together, every other month to connect. And sometimes not everyone makes it, and that's fine. But I know that if I ever have a question, I can reach out to any one of these people and I'll get that support. And likewise, they'll get that from me as well. So it's really special. It is a family. And like Debbie was saying, our alumni Facebook page, it is such a unique place. It's uplifting, it's encouraging, it's helpful and supportive. Whether you have a question like Debbie that was client specific, or you've got an industry specific question, everyone's willing to help and offer, their information, their expertise. Just today, I was on there and someone put, hey, share with me your most impactful coaching question. And it was great to see everyone's responses and these unique questions that they ask as a coach, and little nuggets that you can take away. So it's like, once you're part of FMCA, you're always part of FMCA.
Thank you both, Debbie and Carrie. Great examples of just the community. And I would just like to add, being a collaboration partner with the Institute for Functional Medicine, one of the amazing things that we get to offer our graduates is this wonderful coaching alumni initiative. And so what that looks like is, as providers and practitioners are going through IFM's programming, and then we have our graduates who are functional medicine certified health coaches, and they are in the alumni program. They have this new opportunity where they can get connected with a functional medicine provider, someone who's going through IFM, and they can coach that provider or the practitioner on a particular lifestyle modifiable, lifestyle factor, whether that's the elimination food plan, or that is something that they want to work on regarding sleep or movement and exercise. And this has just been an amazing initiative that has started and continued with our alumni program. There's beautiful results that are being tracked right now, and we're utilizing these for some outcomes research. And one of the coolest things is that providers and doctors right now are really understanding the value of a functional medicine certified health coach. And they're seeing that gap between their patients and themselves, and with some of the lifestyle changes that they're prescribing or sharing with their patients. And they're seeing that the functional medicine certified health coach is that key, that lock and key that can really support their patients and help move their progress forward. And then on the flip side of that, our graduates are getting real-time practice and experience with these providers and practitioners. And a lot of our coaches are now getting referrals and or positions being offered to them because these providers are really seeing the value. So that's just an amazing, very unique opportunity that our program offers as you're a functional medicine certified health coach and in our alumni program. And then of course, I would say most the people that come to our program, they just love learning. That is one of their top strengths. And so the learning does not stop when you graduate FMCA. We have in our alumni program continued access to what we call ATEs, or Ask the Experts. So you always get to continue and stay up to date with the most current content and research as well. And then there's continued access to coach mentoring as well as business mentoring in our alumni program. And then we have these really cool connect and collaboration workshops where you get to workshop a particular area, let's say of your business. Maybe it's what is your niche or what is your tagline? You get to work with other alums, current alums that you might be, you might have graduated with, and then alums that have graduated before you. And like Carrie has said, this is just a very supportive, uplifting community where we really believe that a rising tide lifts all boats, lifts everyone. So everyone here is here just willing and able to support and provide guidance in whatever way we can. So I want to come on over to, thank you all for your patience. I want to come on over to the Q&A. And we had a question that came in from Dana. Thank you so much, Dana. Her question is, can you expand a little more on the differences of FMCA philosophy versus other programs? So I'm going to hand that over to Debbie, who can kick us off, and we'll all probably share a little bit. But Debbie, you want to kick us off? Thank you.
Sure. Okay. FMCA philosophy. Well, from other programs, I think the way I'm hearing that question is, again, FMCA focuses on the whole body, teaching coaching through the whole body, whole story. That's very important to someone like myself and many, if not 99 point something percent, if not all actually of the callers who call in, because something out there said another approach didn't work. So the difference would be, again, the collaboration with IFM. So we're going to learn those systems of cardio and endocrine and mitochondria and inflammation and just how it all begins to work together. And in understanding how it works, then we are better in tune with the person who's sitting across from us who says, I can't think at work. My relationships are just really dying. I don't understand. I have no energy. Because we stay in our scope of practice. I'm not an expert in prescribing, diagnosing, all of those things, but I am going to listen to that story and say, tell me more, what's going on? And through this training, I'm able to hear, maybe I'm hearing nutrient deficiency, maybe I'm hearing an old chronic sinus infection started when they were in college in this old what do you call it, dorm room, so you start putting these clues together using the timeline, the matrix, the tools that we're taught to use. And this is all beginning now to take shape and supporting me, the health coach, in supporting the person sitting across from me. So again, if it comes back to philosophy, the differences between, it would just be the strengthening of really listening to that whole story, being a bit of a detective, listening for clues, helping the client that's sitting across from you raise their awareness to those connections. And maybe if I were to just pull that out, I might say this is a very aha-rich experience in teaching, and then in what I can support a client with. Very aha-rich. I don't know, how would you guys build on that?
Harry?
I think I'm going to take that one step further and talk about how we teach coaching. And I, like Elise mentioned before, that we take the National Board for Health and Wellness Coaching, scope of practice to the highest standard, and we train our coaches that way. But when you're in your live training session and you're learning how to coach, we really believe that you're not going to learn how to coach by listening to someone talk about coaching. And you're going to learn about coaching by getting out of your comfort zone and practicing. And the model we have set up, where you are coach, you are the coachee, and you are the observer of the coaching, the one providing the feedback, is so critical and so key to really being coming out of the program as a confident coach.
Beautiful.
Yeah.
Thank you. And I guess the way that I would answer this question is, the differences between the philosophy of FMCA and other programs. So I smile because Debbie shares this analogy or metaphor quite a bit. And, there are so many different programs out there. And if we look at programs, health coaching programs, it's all like, they're all fruit, right? But when you do compare FMCA to other programs, it's kind of like comparing an apple to an orange. And so our unique philosophy is really based on the functional medicine philosophy, as well as the positive psychology philosophy. So I'll get into that in just a quick second. But the functional medicine philosophy is systems based, it's evidence based, it is looking at the whole person. And we're also taking a personalized approach, a therapeutic personalized approach to that unique individual. And we're taking a client-centered approach as well. So we're really meeting that person where they're at, while looking at the whole person. And then on the positive psychology side of things, we're also looking at what's going well with this person. That's where we start. We're not looking at all the not so great things or what's not going well. Of course, is that important? Yes. And we want to look at that, but we're going to start with what is going well with you. And we're also going to look at what are your strengths. And so I always give this example. I'll give a really quick one here, but let's say, you're working with a client who just recently got a diagnosis of, let's just say, celiac disease, and they have to go a totally gluten-free lifestyle. And this is totally new to them. They're a little bit hesitant, might be resistant. And so as you're working with this person and you're taking the functional medicine philosophy, that approach, you're taking the positive psychology approach, everything that we're teaching and training you on in FMCA, you might, now there's a million and one different ways that you could approach this person, but you might work with this person and kind of start off with some open-ended questions by asking them a little bit about their background. Maybe you pick up, because you're listening, about their culture. Maybe they come from a very Italian background, and every single Friday night they have Italian dinners with their family, and their grandmother, makes homemade pasta, and now you can't have that. And so that's a big barrier, where the functional medicine certified health coach is going to come in and really listen, create that safe, non-judgmental space, really hear you and see you as an individual, and pick up on some of the strengths. And they might have, they're going to remember that maybe one of your top strengths is creativity. And so they might say to you and really walk alongside you, what Carrie and Debbie were sharing, and say, I noticed you really got this top strength of creativity. And I just wonder, how could we utilize that in the kitchen? I'm wondering how might you be able to still enjoy the pasta dinner, but maybe not the pasta? What are some of your ideas? And so it's really about a collaboration and coming together with that client and really allowing them to step into their own power and really just you're really walking side by side, shoulder to shoulder, guiding them. So I hope that kind of paints a little bit of a picture for you all. And there's so many more examples where this comes from, but I hope that starts to create a little bit of a picture. But that's one of the key main differences in philosophy of our program versus some of the other programs as well. And I think the last thing I want to add about that is just the uniqueness of the live training sessions. There are, I would say in other programs, they do offer styles of the live training sessions, but I would say that ours is the most unique in the consistency and the amount of live training sessions that you get. So it is a requirement for the program to actually graduate from the program. And like Carrie and Debbie were sharing, you get to sit in your live training sessions. You get to be with a small cohort of 12 to 15 students and a course facilitator who is there to provide feedback and support you. Your cohort is there to provide feedback and support you. And like Carrie was sharing in those live training sessions, you're going to be role playing. You're going to be the coach, the coachee, the observer. You're going to be getting what we call glows and grows. So what are you doing well? What could you be doing better? And so there is this consistency that 3 times a month for 2 hours at a time. And I've heard that these live training sessions go by really quickly. So I know it's one of the most favorite parts of the program for a lot of people. But that's really where the rubber meets the road, and where you really start to take all the content that you're learning and really pull that through into the practice implementation. That's really, really where you gain your skills, your tools, and your confidence throughout the entire year, so that you are ready to sit for that exam afterwards and start coaching. So I know that was a mouthful. Thank you all for listening. Just a couple more questions here before we wrap up, because we want to be mindful and respectful of your time. And Danielle asked, when you finished the course, do you feel prepared to take on clients from a nutrition standpoint, or did you feel you needed a deeper dive into the nutrition? Debbie, would you like to start off with that? Thanks.
Sure. Okay. Great question. Really good question. So I do not have training in my background on nutrition. I'm Italian. I just eat what I want. And so I came to this, functional medicine again for my daughter's journey. That's important because when I went through this training, and we do sit with someone then, and again, my world is mood and stress disorders, social anxiety. There's a gut and brain something going on there. So we always get into food. And this training supported me in, again, listening. And I learned nutrition through the food plan. So I learned histamine, salicylates, lectins. You learn what those are, how to use them, what drives food sensitivities for some people, how to identify an allergy. So those pieces do come together in this training. And again, scope of practice, I'm not going to diagnose or create a food plan, but I'm going to listen to what's going on for a person as they tell more and more of their story. And maybe just a quickie, because I know we're ending, is through our Find a Coach support in our, that the graduates have access to. I was paired with a nurse of 30 years. And so she came to the call, and I'm thinking, well, how can I support a nurse of 30 years? What am I going to know as a new coach? But sure enough, using these tools and my level of knowledge with nutrition, she didn't want to look at her food plan. She said, I eat healthy. We don't need to look at it. But by session 2, I said, would you mind if we just humor me? Can we what do you eat? What's healthy? What's good? I can always learn. And sure enough, as it unfolded, she had an extremely healthy food plan, but it was very high on histamine. And when we pulled it back and we took a curious look at what was driving her symptoms, sure enough, she had an histamine intolerance. And so we paired her with the right doctor to support her for looking or taking a closer look at that. So that's just an example of how a new coach with this training really can have those ears using that nutrition training to support someone. I hope that's helpful.
Thank you, Debbie. Carrie, how about you?
One of the most important things you can learn in this program is how to coach without being the expert. And we call it the coach approach. And it's just an incredible skill to watch and to observe someone do. And you'll do that in your live training sessions. You'll watch your course facilitator exemplify that. And we learn that the power is not necessarily in being the expert, but the power is being able to help someone change. And I think that's important when it comes to nutrition is, you just don't feel like you have to be that expert. But when you, like Debbie said, when you can listen, when you can motivate, and when you can uncover what's going to allow them to make those changes, that's where the power really lies.
Thank you, Carrie and Debbie. Beautifully said. And Danielle, I hope that answered your question. And thank you to everyone so much for joining us and asking questions, for listening and leaning into your curiosity, and for most importantly, just being a part of this community, whether you join us or not, or maybe at a later time. But I just want you to walk away knowing that we're here to support you on your journey towards becoming a functional medicine health coach. And we encourage you to continue the conversation. You can reach out to us, you can schedule a call or enroll with us. And we look forward to staying connected. I also wanted to let you know that our early enrollment is happening now through May 18th. And this is going to be the best tuition that we're offering, which is $7,779. Our standard tuition is $9,779. So we encourage you to, if this program is really speaking to you, to pick up the phone, continue the conversation, reach out to us. You can schedule a call, or you can go ahead and enroll. And again, we are here to support you on your journey towards becoming a functional medicine certified health coach. So once again, thank you so much for spending your time, for your questions, and I look forward to connecting with each and every one of you. Thank you.